Our next topic affects millions of Americans every day. Asthma is the most common chronic lung condition impacting children, and the CDC has issued a progress report of sorts.
Analyzing data from 2001 to 2016, the CDC estimated that in 2016, 1 in 12 American children had asthma. In that 15-year time period, those experiencing an attack dropped by around 8%. Even more significantly, from 2003 to 2013, hospitalizations dropped roughly by half. Dr. Narula, this is a tough issue for children. How much education is there targeted towards children on the subject of asthma?
There's really not enough, and we've done better over the last 10 to 15 years, but we have a lot more that we can do. When you look at the fact that 1 out of 6 kids with asthma every year end up in the ER, 1 out of 20 with asthma end up hospitalized, and many times kids have more than 1 exacerbation per year, education can go a long way. And when you look at how we're doing now, about 50% of kids really get the action plan that's recommended to kind of teach them how to deal with a situation of exacerbation. About 50% get taught how to use their peak flow meters. Less than 50% really get education on environmental triggers like air pollution, tobacco, pet dander, and only 70% get taught how to recognize those early warning signs or symptoms. So we have a lot more we can do.
Keeping up with medication is difficult for adults, so I imagine it's got to be especially tough for kids.
As a physician who takes care of adults, difficult. Yeah. As a mom who takes care of kids, very difficult for both adults and kids, but very important. And I think if you take the time as a physician or a parent to sit down with a child and tell them why are we giving you this, it can make a big difference. And right now, really about half the kids who should be getting those asthma control medications, about half are taking them regularly as prescribed, and 9% are really overusing the rescue medications. So one other thing I want to mention before we jump off this is that when you look at the kids this year hospitalized with flu, the #1 comorbid condition is asthma, okay? So really important for kids who have asthma to get vaccinated for the flu.
All right, finally, eating your greens to preserve brain health. A study published in the journal Neurology looked at 960 participants taking part in the Chicago-based Memory and Aging Project. They were between the ages of 58 and 99 and completed a food frequency questionnaire along with 2 cognitive tests over a period of nearly 5 years.
The major finding, eating leafy green vegetables was associated with slower cognitive decline. In fact, those who ate the most leafy greens showed the equivalent of being 11 years younger than their actual brain age.
Kale will save us all.
Kale, spinach, collard greens, half a cup of cooked or 1 cup of raw. It's not a lot per day.
That whole spinach Popeye thing there's something to it.
Yeah, and if you're a kid, eat your greens.
That's right.
And take your asthma medication.
Exactly.
They are both good for your long-term health.
Salad for breakfast.
Yeah, exactly.
Narula.